you were talking to me earlier when we were discussing this that you're finding that thread lifting is a big thing, and I
Yeah,
find that interesting. I think that to me is a trend that's going to take off in the next little while. And it's funny because it was
yeah.
around. It hasn't. It's not new. It's been around for a long time, but it does seem like it's kind of having a resurgence. How do you
Yeah, well,
find?
it was just, I mean, I think it was in Canada, and then they got pulled off the market, and then they revamped the threads. It's been in the U.S. for a couple of years. It just became approved in Canada. The one brand that is approved, which is the Silhouette Instalift. I think the approval came in around, I want to say like March or April, like for this poor company, like right in the middle of the shutdown. Um, I mean, you can get a lot of threads in Canada, but they're not approved. So this
Mhm.
is the only one that's Health Canada approved. So that's the only one that I would do. It's interesting. I think again, it goes back to education. People have to understand, like when I do a thread lift and you do a facelift, that's not the same thing.
Right.
Um, right. So it's educating people, what kind of improvement they're going to get. But it is great because there's some people that have great volume and they just need that little bit of lift. I think thread lifts can be great for that.
Yeah. So
I think it's
where is
for
it filling? What niche is it filling in your practice?
So I think it's for lift when you don't need volume. I think necks are going to be an important area that we
Hmm.
can treat for people who just aren't quite ready for a neck lift or just aren't interested in surgery. It's a little bit like injectable Sculptra, at least in the upper face, and I love Sculptra because you can vector a bit with Sculptra and get some of that lift, and then you get a little bit of volume, and I think skin improvement as well.
Hmm.
So yeah, I think it has its place. Time will tell.
Yeah, I'm excited to see where that goes. To be quite honest, um, I think the filler market has probably reached its max. I think I think there is almost kind of a tendency now to go kind of have people get overfilled because it's so accessible, and it seems to be a kind of an answer to every problem these days, and
Yeah.
I think that's I don't necessarily think that's good, and I think threads could potentially get people to move away from kind of the overfilled face look. So I think it's a great new trend actually. I mean I'm excited to see how it how it changes things long term and where it
How do you
ultimately.
feel about non-surgeons doing threads?
Well, I mean, it's a, I mean, I think all of these things are surgical procedures. They're just minor
Yes,
surgical procedures, first off.
absolutely.
And I do get nervous about how casual we have all become about all of these procedures.
Yeah.
And I think you alluded to that earlier, that they are so accessible that we're very, very casual. We're thinking that these things are like getting a cut and a color,
Right.
haircut and color. And they're not. They have real consequences. They are minor surgical procedures. They can be done poorly. And to be honest, they cost a lot of money. So you kind of, if you're paying a lot of money, you're hopefully getting it done by somebody who knows what they're doing and can kind of manage it properly. So I don't know. I'm not sure that there's an easy answer to that. I think it comes down to how good the person is and how much experience they've had. But there are a lot of non-physicians that this has become open to, and I think that's a little bit of a concern for sure.
Yeah. Yeah, I think so. I
What
mean,
are
when
your
we do it in
thoughts
our
about that?
office, we definitely treat it as a procedure. Everything is sterile. It's in terms of it's the highest level that we do. Everything else we do clean. In terms of gloves and things, this is sterile fields, sterile gloves, sterile towels, big prep on the patients. And I think when people say, oh, it's just like getting filler, it's not. It is a big procedure and it has some downtime, but then, like all things, it's risk reward, a little bit more downtime, a bit more lift, a bit more long lasting results. So,
Yeah, and as you say, there are different types of threads out there, and there's only one of them that's Health Canada approved, but there's a bunch of them that are FDA approved, and they're very different. They are very
Yeah,
different.
they're like the PDO threads.
Yeah, yeah,
Yeah.
they're very different. And the other thing I think is that we have to stay aware of is that there are, some of these things can have long term effects, and they can kind of linger around and come back. And for instance, I'll use the example of fillers, like large volume filler augmentation. It shouldn't necessarily be such a casual thing because it can have long-term consequences. And I certainly see patients, not a lot, but the occasional patient who has things like recurrent swelling, you know, and doesn't know what to do about it, or doesn't kind of recognize why it's there. And this could be years after the fact, or they get granulomas, or they get, this or that. And so I just think we can't be so casual about these things.
Yeah, for sure. I mean, there definitely are risks, and that's one of the things that I always go over with my patients. I say, look, I'm going to tell you the scariest things, so that so that you're not going to go home and read about it on the internet and then wonder why I didn't tell you. So I want to tell you everything, so I'm being completely truthful about you. But then I'll tell you my experience over the years, how often we see this. I treat a lot of other people's patients when they run into problems. And I've held a lot of hands through these procedures, and thankfully, everyone's gotten through it, right?
Yeah.
But I think it's important that people know what's out there, and that it isn't just a color and a cut.
Yeah, exactly. And it should be done in the grand scheme, like in the global sense of managing someone's aesthetics long term, and not just kind of one-off procedures, which I think happens a lot. Yeah. And that's,
absolutely,
I think, part of what.
That's a great point.
Yeah, yeah, but I think that kind of the filler thing is, I see it a lot. I see kind of people having large volumes, and there was an article in the PRS journal Plastic Reconstructive Surgery last month, where patients had MRIs years after having filler, and you could see there's still filler in them. Even I think one of the patients was over 10 years after having had. And so I think these are kind of things that, like I said, I mean, they're just not to be taken casually. Like, they're just kind of should be managed. They should be managed in a long-term place where, that's reputable. And